Cardiovascular diseases are the #1 cause of death globally. More people die annually from cardiovascular diseases than from any other cause. An estimated 17.9 million people died from cardiovascular diseases in 2016, representing 31% of all global deaths. Of these deaths, 85% are due to heart attack and stroke. Over 3/4 of cardiovascular diseases deaths take place in low- and middle-income countries. Out of the 17 million premature deaths under the age of 70 due to non-communicable diseases in 2015, 82% are in low- and middle-income countries, and 37% are caused by cardiovascular diseases. Most cardiovascular diseases can be prevented by addressing behavioral risk factors such as tobacco use, unhealthy diet and obesity, physical inactivity and harmful use of alcohol using population-wide strategies. People with cardiovascular disease or who are at high cardiovascular risk, due to the presence of one or more risk factors such as hypertension, diabetes, hyperglycemia or already established disease, need early detection and management using counseling and medicines, as appropriate. If you experience a combination of any of these symptoms, it's important you or your caregiver calls a health professional to get the help you need. Number 1. Aching in the shoulder and chest. Chest pains, especially on the left side near the heart, have long been a sign for a potential impending heart attack. The pain is caused by the death of heart muscle cells. Tightness and strain on the heart can sometimes be so painful that the pain can make its way to the upper torso, especially the shoulder area. This is called angina, which is associated with pain directly related to the irregular and interrupted flow of blood to the heart. Sharp pain in the shoulder usually doesn't indicate a problem with the heart, but a slow and gradual building of pain in the shoulder area may be an indication of unhealthy heart issues. Number 2. Snoring and sleeping problem. Snoring and sleep problems like insomnia and sleep apnea, a disorder where there are disruptions in your breathing while you sleep, have been directly linked to heart disease and other cardiovascular issues. Episodes of sleep apnea, which can cause sleepers to wake up gasping for air, cause inconsistent sleep patterns that can be stressful on the heart. Sleep apnea prevents restful sleep and is associated with high blood pressure, arrhythmia, stroke and heart failure, the American Heart Association said. Recently developed sleep apnea or snoring problems can indicate there is something wrong with the heart. There is also a disorder called obstructive sleep apnea (OSA), which is directly related to high weight and obesity, two leading factors in heart disease. OSA occurs when weight on the upper chest and neck contributes to blocking the flow of air, causing anxious sleeping patterns. Once sleep apnea has been treated and/or corrected, doctors have noticed drops in patients' blood pressure. Number 3. Irregular heartbeat. An irregular heartbeat is more formally known as arrhythmias, which means that your heart isn't pumping blood at its normal rhythm. While you can be relatively healthy and still have an irregular heartbeat, it is also an indication for heart failure or an impending heart attack. High blood pressure and coronary artery disease, blockage in the pipes of the heart, are the main causes of blood vessel disorders like an irregular heartbeat, the Heart Rhythm Society said. Arrhythmias is caused by the interruption of the electrical system that controls the heart. There are many different types of arrhythmias, some which indicate your heart is failing. Number 4. Shortness of breath and fatigue. The American Heart Association said shortness of breath is an indicator of heart failure. The AHA described situations that indicate a shortness of breath, and they include: you have breathlessness during activity, most commonly, at rest, or while sleeping, which may come on suddenly and wake you up. You need to be propped up after having difficulty breathing while laying flat. You wake up feeling tired or restless after sleeping through the night. Blood vessels can get backed up due to an unhealthy heart, and it starts spreading to places it shouldn't be, like the lungs. This causes shortness of breath. Number 5. Difficulty with sexual function. Erectile dysfunction, the inability to get and keep an erection firm enough for sex, can be an early warning sign of current or future heart problems, the Mayo Clinic reported. ED can be caused by an improper relationship between the flow of blood from the heart to the penis, indicating possible atherosclerosis, the narrowing of arteries, and a cause for heart disease. Sexual dysfunction was related to the severity of cardiovascular disease, one study said. When they resumed sexual activity, patients with heart disease reported significant difficulty, including a lack of interest in sex, sexual dissatisfaction, and a decrease in the frequency of sexual activity, which highlights the connection between sexual problems and heart disease. This study included women, too. Female sexual drive can diminish due to improper blood flow to the genital area caused by an unhealthy heart.